Awesome. So we are now live on Facebook. Good afternoon, everyone. My name is Ashley Jones, and I serve as the coordinator of parent and family programs in the Center for Student Success. And we're so happy to have you with us for our first Seymour Scoop of 2021. And it is with the Student Health Services at Moffitt Health Center. And we are just so grateful for you joining us every month. Each month, we bring you a Southern Miss resource that's available to your student in hopes that you can get a little bit more information about some of the resources that are available on campus so you can share this information with your student to definitely take advantage. Today, we're joined with Ms. Kayla Johnson, who serves as the Health Educator and Promotions Coordinator at Student Health Services at Moffitt Health Center. And she's going to give us some information about Student Health Services, some things that they offer for students, how to get in contact with them, some services that they provide. And of course, we'll talk about the elephant in the room, coronavirus and the COVID-19 vaccine. At this time, I will give it over to Ms. Kayla Johnson for a brief presentation. After the presentation, we'll have some questions and answers, and then we'll wrap up with our contact information at the end. Kayla.
All right, thank you so much, Ashley. I'm excited to be with everyone today. I'm going to share my screen real quick so that we can get this short presentation going. Just give you a little bit of a visual. If you want to screenshot, take notes, etc., maybe make this a little bit easier for you to do. But like Ashley said, my name is Kayla Johnson. I'm a Health Educator and Promotions Coordinator here at our student clinic on campus. I actually have 2 degrees from Southern Miss, and also am a certified health education specialist. And so pretty much what our office does is provide educational resources for students as part of student health services, and do outreach and engagement sessions like today. So just to get started, I think it's very important that, people are aware of where we're located. It's kind of hard to use a resource if you don't know where we're at. And so the first floor of Scott Hall, which is part of Century Park South. Our main entrance actually faces the parking garage, but something that we've done this year, just in response to COVID-19 and trying to limit contact between patients within our clinic, is we've actually opened an additional entrance that allows those students that are coming in for COVID-related visits or testing to use a separate entrance from those who are coming in for maybe just a medication refill or just needs to, address a concern with a provider. We are open Monday through Friday. That's 8 to 5 Monday through Wednesday, 9 to 5 on Thursday, and 8 to 4:30 on Friday. During the week, of course, whenever your student is going to be going to and from class, maybe grabbing lunch, attending an event by a student org, those high traffic times on campus is when our doors will be open. Of course, that doesn't cover after hours or weekends, but we don't leave students completely in the dark and without resource. We do have some information on our website if they visit it that's specific to after hour resources so that they can be aware of other clinics in the area that do have those after hour and weekend capabilities. We also have a full service pharmacy, which isn't something that all universities are fortunate enough to have. So we're very lucky to have a full service pharmacy. And they are open Monday through Friday as well. The only difference in their schedule is that they open at 9 a.m. Daily, Monday through Friday, instead of 8 a.m. Like the clinic does. So, just be mindful of that hour difference there as we start the day. As far as our providers and our staff goes, we do have board certified physicians, nurse practitioners, physician's assistants. We have RNs and LPNs that assist our providers. We do have a full service lab as well. So we have medical technologists that operate that. So we can do labs and x-rays. And then of course, in order to have a pharmacy, you've got to have registered pharmacists that operate that. And then myself and one other make up the health education team of health educators. And we also do have a few doctoral level graduate students that work with us in our office that provide some mental health, behavioral health type resources as well. So what do we do exactly? Best way to think of us is as a primary care and urgent care clinic. So anything that you would expect your student to be able to receive off campus at an off-campus clinic or healthcare center, they can receive right here on campus. As long as they're enrolled in classes, it doesn't matter if those are online, in person, a hybrid, where they're partially in class, partially online. As long as they're enrolled, they have access to us. So fall, spring, summer semester, we are open year round. The only time we close is for holidays, when the university closes, or if there's like severe weather in which the university closes as well. So just a quick overview of the different services we provide. Of course, acute illness and any type of injury evaluation and treatment when possible. We can do minor surgical procedures and laceration repairs. So, like an angle toenail removal, if somebody comes in with a cut that's pretty deep, we can do stitches to repair that. Of course, women's health, included in that is pap smears, as well as birth control, and just any questions related to women's health. Men's health as well, physical, say for it be a job, maybe it's that your student wants to partake in some sort of athletics or intramural sports through campus recreation. We do provide physicals here. Of course, we have students that like to study abroad, and that's a whole lot of fun. So we assist them in getting their consultations prior to their travel, helping them get any immunizations that they would need. Of course, I think I already mentioned labs and x-rays. So there's a good number of those labs and x-rays that we can actually do in-house. So that means the student's able to get that result the same day. And so that's super convenient. I'm not a student and I still appreciate things being done quickly, in regard to my healthcare. So I think it's great that we can offer that for the students. We can also do immunizations. So you're probably well aware that we require 2 MMRs here at Southern Miss to get started. If a student is going to be living on campus, they're soon to require proof of both meningitis vaccines, ACWY, and meningitis B. That's 2 separate vaccine series. So they'll have to have proof of that here soon. We do administer all of those vaccines here. So if a student does need any of those or needs to get called up, they can certainly come see us for that. Allergy shots as well. So we do not have an allergist, but if your student is currently seeing an allergist and is doing allergy shots through that provider, they can actually have those sent to our clinic and we can administer them here. And the student just has to hang out with us for about 30 minutes to make sure there's not going to be a reaction. Of course, our full service pharmacy and then our health education team also. So in regard to our pharmacy and kind of how they operate, it's just like any other, I guess you could say, commercial pharmacy that you'd be familiar with. So we're like CVS, Walgreens, Walmart, any of those that you can think of. We function pretty much the same way. The difference is they're a part of USM and they're located in our front lobby. So the same waiting area that students use to check in and then wait to be taken back to see the provider, they'll also use that same waiting area to wait for their medications. Now, one thing that's awesome about our pharmacy is because it is only for the campus community, typically can have your medications ready to go in probably 5 to 15 minutes. I say 15 minutes when cold and flu season hits, things might get a little backed up depending on how busy we are and the number of prescriptions that are being written and filled at that time, but still much more convenient than having to get in your car and drive across town and then get there and get frustrated because they still don't have your medication ready. And so it's super convenient. They do accept most insurance. So just want to make sure that your student has a good copy of your pharmacy card. If they're on a medication from an outside provider and they'd like to get that sent over to our pharmacy and just get everything filled in one place, they're certainly welcome to do that. They can work with our pharmacist on kind of what that process looks like. Sometimes it's just a matter of calling the other pharmacy and getting it sent over. And then sometimes we do have to have an actual physical copy of that prescription if it's a controlled substance like, say, ADHD medication. Competitive pricing in the sense that most of what we keep in stock is generic, if generic is available. And if you're familiar with how medications and everything work, generic is typically much more affordable and less expensive than a name brand medication. And so that's super helpful. We do also have some over-the-counter medications. So, if they need Tylenol or ibuprofen as well, and they don't want to go all the way to a store to get that, they can stop by our pharmacy during business hours. And again, just want to reiterate, it's quick, it's convenient. You're already here to see the doctor, and so why not get your medication in the same place? So we do encourage students to utilize our pharmacy if they're able to. As far as HIPAA and the privacy rule that we abide by here, because we are a healthcare entity, we do take the confidentiality of students' health information very seriously. So if your student is 18 or older, under the federal HIPAA law, we cannot release a patient's information to anyone. That includes parents, even if the parents are, the insurance holder and the guardian and all the things. We can't release that information without the patient's written permission. So if you do want your student, to fill something out, or if you've had that conversation with your student where you'd like to have access to that, they can come by the clinic and fill out a medical release to where we can release that information to you. They can specify what information they would like to be released. So if they want you to have access to certain things, but not everything, they can specify that. But that would definitely be a conversation that you would want to have with your student. Some students don't care at all. They're going to call their mom and dad and tell them what the doctor said anyway. But then some students are very private in that matter. So definitely a conversation to have with your student if this is something that you would want access to. As far as our fees go, I say it all the time, but I wish we could be. I wish we could be a free service, but the reality of things is that we do have to charge a copay in relation to provider visits, and so there is an office visit / provider fee of $20. I will say that that's usually much less than what a normal copay would be through your insurance company. So say if your copay is $25, that student is still only going to pay $20 for that visit. So it does make it a little more affordable. In the event your student has any labs done, maybe some x-rays, if there's any type of injection done, like maybe a celestone shot, if there's any immunizations done, if crutches are supplied, if there's any procedures like an ingrown toenail removed, any of those things, as well as medications that are purchased through our pharmacy, all of those are additional charges. So that's not included in that $20 provider fee. So it's really important that if your student has health insurance, to bring that information with them. We've even made it easy for students to where, if parents only get 1 or 2 insurance cards and they don't have an additional one to give to their student, we can even take pictures. So the student can, text mom, dad, say, hey, send me a picture of the front and back of that insurance card, and then they can share that information with us. So we don't actually have to have the physical card. We just got to have a good quality picture that gives us the information from that card, and we can work with students there. Now, any fees that are associated with a visit can be paid at the time of service, or the student has the option of charging it to their student ID. So it would go to their SOAR account. That is definitely a perk of being affiliated with the university. If the student were to go off campus, it'd be a much different scenario. They may be asked to pay for the visit in full. It may be that they would, charge them a certain fee, bill the insurance for the rest, and then the student would receive a bill for that remaining balance after the fact. We don't really function that way. Instead of sending a bill to a student, if a student does come in and say they have some lab work done, maybe they've been really healthy all year, haven't really had to go to the doctor much, so they haven't met that deductible yet. So insurance might pay a little bit, but they don't quite cover everything. In the event something like that would happen, we would bill it to their student ID, just as if they were standing in front of us in the clinic. It would go to their student ID, and then that can be paid back through the business office, just like all the other campus financials at the student's convenience. So it does have to be paid off in a timely manner in order for students to be able to enroll for the next semester and and get signed up for classes and whatnot. But it is an option to allow students a little more time to pay for their health care, so that hopefully the cost of being seen at our clinic isn't a barrier to them seeking care. So we want them to know that they do have an affordable option with a facility on campus that will work with them, in terms of getting those fees paid, should there be any. We do take cash, credit, debit, and check. So whatever your student has and would like to use to pay for those visits, they can do that at their discretion. So how do we function in terms of appointments, walk-in, etc.? We've actually kind of shifted to an appointment only format, kind of in response to COVID-19. Again, it just helps us limit patient contact with one another, especially those patients that, would be suspected COVID-19 positive, or, maybe asymptomatic and just want to get tested. So appointments are required for provider visits. So a couple ways that your student can make that appointment. Of course, they can pick up the phone, the old-fashioned way of giving us a call at the number you see there. They could stop in and visit our front desk and talk to one of our receptionists there, and they'll get them set up with an appointment. We also have functionality on, I say iPhone app, but I believe it's available on Android as well, with the iSouthern Miss app. That students are encouraged to download pretty early into their Southern Miss career. But you can go there, choose student status, click on help, find our clinic there, and then choose our health portal. And through that health portal, students can make appointments. They can access any labs that they've had done with their clinic, as well as any immunizations. So if your student gets an annual flu shot and needs to show proof to their employer that they got that flu shot done, they can go to that portal and access that information and not even have to come by our clinic. So super convenient there. And it also helps them not have to actually talk to a person if they prefer to not talk to a person. So trying to kind of meet the students where they are. Also online, you can do it through our website. If you go to our main page, there's a little yellow box there right at the top that says, online portal or patient portal. And so that same health portal can be accessed there as well. As far as immunizations go, we do not require appointments for those, just because those are nurse visits and are typically pretty quick. So, if somebody doesn't want a flu shot or needs to get updated on maybe an MMR or something like that, you don't have to have an appointment for that. I think TB skin test is another common one, especially with nursing students. They have to get those periodically. So something like that, that's kind of immunization based, you don't have to have an appointment. It's mainly those things that you're going to see a provider for. A few ways to kind of stay in touch with us. We are on social, so we have a Facebook page, Twitter account, and an Instagram account. And so we use these to communicate with the campus community in regard to our services, things happening on campus as it relates to health. We're currently using it, for COVID prevention, COVID awareness, COVID positivity rates and testing number updates for the university. All of that is communicated through those accounts. So that's a great resource for you as a parent, as well as your student, to kind of stay in the know with what we've got going on. Whenever we have health education events, we promote those there as well, so that students can have a heads up to when something's going to happen. And then if they want to partake in it and be a part of it, we certainly invite them to. But it's just a way to kind of stay in the know with what's going on with us and the health of students on campus, and ways that we can all work together to keep a healthy campus community. Some additional ways to contact us. We've, of course, the clinic phone number. That's also going to be the main line that a student would use to make an appointment. We do have a fax number as well. So if your student needs to share any medical records with us, or fax over an insurance card or something like that, we are able to do that. Our pharmacy does have a separate phone line, so that you can speak directly to a pharmacist when you make that call. We do have an email address that's monitored Monday through Friday during business hours. So, feel free to send questions there. It will be responded to, within the business day, if we're able, the next business day, if received after hours. And then of course our website again, we have tons of information there that talks about our services, insurance questions. I think we've even got some FAQs on there. What about this? What about that? We've got health education resources. We actually took a lot of that virtual this fall, since everything is kind of different with COVID right now. And so different health topics like mental health, sexual health, relationship health, exercise, nutrition, lots of resources that students can kind of access on demand. So I think that's really all I have, at least from a presentation standpoint. And I'm going to turn it back over to Ashley.
Thank you, Kayla. Thank you so much. That was a lot of helpful information. I feel like I learned personally a lot more that Student Health Services offers, and I hope families that you received all of that which was given from Kayla, and that you will share this information with your students. We know that, when you come in at orientation that you receive a plethora of helpful resources, but we hope that these monthly resource meetings that we provide will give you a refresher of some of the things that are available to your student. This video will remain on Facebook, so feel free to rewatch it if you weren't able to get with us from the very beginning. It'll be saved on the page, so be sure to, after we're done, to go back to the beginning so you can get all the information that to us. We do have just a couple of follow-up questions that I wanted to have a conversation with Kayla about. And so some of those are around the coronavirus testing. So does Student Health Services offer the coronavirus testing? And if so, what types of tests do you offer?
Yes, so we actually provide 3 different types of tests in regard to COVID-19. So we have what's called a PCR swab test. It's an FDA approved testing process where we swab your nasal passages, and then that will kind of detect whether you currently have an active COVID-19 infection. So this would be a current infection within, and we usually have those results within 1 to 3 days. So there at first, when things are first getting kicked off, it would take us a little bit longer to get those results back. But typically we have them within about a 24-hour time period during the week. Sometimes those Friday tests do take an extra day or two because we are closed over the weekend. But for the most part, typically 24 hours, and we have those back. Another one that we're able to do is what we call a rapid swab test. And this is also performed that same nasal passages, very similar to if you've ever had a flu swab done. And so we perform that the same way that we do the PCR. The difference is we get those results the same day. So we mainly, now if somebody comes in symptomatic, the provider may do both a rapid and a PCR. They may do only a rapid or they may do only a PCR. It's kind of up to the provider as to how they want to handle that testing process. Good thing about the rapid is if it comes back positive, we know for sure that, okay, this person has COVID-19. We will still send that PCR off for confirmation. But if a person is, say asymptomatic, or I'm sorry, is symptomatic, and we do a rapid and that rapid is negative, we'll still send that PCR off just to make sure that the person isn't actually positive. So it's kind of a checks and balances system, being that the PCR test is a little more accurate than the rapid in terms of a potential false negative. Something that we also offer as part of the COVID testing is related to the rapid test, and it's what we call surveillance testing. And so this would be someone who has not been around anyone that is known COVID positive, so they have no close contact exposure, and they have no symptoms. They just want to make sure, that they don't have it, because we've definitely heard at this point that there can be people who have it and are asymptomatic, and therefore can spread it. So that's something that we offer, and all of these are done Monday through Friday. You do have to have an appointment, but they are available all throughout the week. And so we can do those surveillance tests on anyone that just might want to know. I personally even did one right before the holidays, just as a precautionary measure before being around some family members. And then lastly, The other test that we do is what's called the antibody blood test. And this is actually done with a blood draw through our lab. And so we'll draw blood and then we'll send that off. And typically we get those results back within 1 to 2 days. But what that does is it can detect a previous infection or exposure to the disease. So a couple different options there. We will bill insurance for all of those. Now, there may be a fee associated with the antibody blood test if the insurance does not cover. But as far as the rapid and PCR swabs, we do bill those to insurance, and there's no fee to the patient for those two there.
Awesome. Thank you. Thank you for letting me know that. I had questions about that as well, so that was very helpful. Regarding the vaccination, can students receive the COVID-19 vaccination at Moffitt Health Center?
So we currently don't have the vaccine available here. We have applied to be able to administer it to the campus community, but the vaccine itself is not available to us yet. And so we do have some information available on our website. It's actually on our main index page. So if you use that link provided earlier, you go to that. If you'll scroll down, you'll see some COVID related information that we've got there for you. And part of that is providing information as it comes available through the Mississippi State Department of Health as it applies to the vaccination and that process and how you can go about getting vaccinated. And so as of yesterday, they've actually opened up some additional categories. So those 65 and older, which may be some of our professional staff and faculty and stuff here at Southern Miss. And then also those 16 to 64 years of age that have chronic health conditions. So some of those that we would think about with a student population would be maybe obesity, sickle cell disease, maybe smoking, maybe diabetes, or any other type of medical condition that, that would be determined by a medical provider. And so there is a little more availability there as far as how they've expanded access to that. Now, it doesn't change the fact that we still don't have the vaccine here, but it does allow more people within our community to go through that process of trying to get vaccinated. As part of that information that we have on our website, and we will update this regularly as well, is some information on where students can go if they want to get vaccinated. The State Department of Health has some drive-through locations set up. There's also some local clinic providers that have access to the vaccine, and appointments can be made to receive it there. But at this moment, we don't have it, but as soon as we find out if we're going to be able to get it and things of that nature, we will make a point to communicate that with the campus community. We'll use the different communication outlets for the university, but we'll also use our social media site. So again, that's one more reason to keep up with us on your preferred social media outlet. And just kind of, check in with us regularly. We're going to keep these updates rolling out. So, anyone that has a question can feel free to reach out to us about that.
Thank you for sharing that, Kayla. And I can personally attest to you guys in your social media platforms. I do follow you on social media. And if you follow the parent and family pages on Facebook and on Instagram, you will probably periodically see some information shared on our platforms from Moffitt Health Center. And so I will share that. So anytime that you share any important or pertinent or new information, I also share that on our platforms as well. So definitely be on the lookout for any new information being shared on Facebook and Instagram.
Excellent. We appreciate that very much.
You're welcome. Not a problem. Thank you for sharing it. Just a couple of other questions regarding parents' roles and how parent and families can assist. So what role do parents and families play in assisting their student to seek services at Moffitt Health Center?
Yeah, so I like to think that when a student feels bad, the first person they're going to call is mom and dad, more than likely. And so by having our parents and our families aware of the services here at Moffett, they essentially become advocates for their student and for us as a facility and resource on campus. So by being aware of what we offer, when that student does call home and say, hey, I'm running a fever, I've got a cough, this is what's going on, they can say, oh, well, remember Moffitt Health Center that that's, on campus, right there by the parking garage, why don't you make an appointment and go see them? And so it helps connect us with those parents. It helps connect those parents and the student with us in a way that, we may not reach that student, but if we can reach that parent or that family member, we can work together. So it's a collective effort. Another thing that we find with students is that they can sometimes be a little stubborn about going to the doctor. So just encouraging them when they are feeling, maybe under the weather, or maybe there's something going on, just encouraging them to come see us. It may be that they're already aware of us, but they're just, kind of, I want to go to the doctor. I don't, so maybe that they're intimidated by the process, and maybe this is the first time they'd be going to a doctor by themselves. And so, encouraging them to take charge of the healthcare and going and getting seen and taking the steps to keep themselves healthy and hopefully, if they are getting sick, maybe catch that illness early before they start feeling really, really bad. And so that's the biggest thing, is just by parents and families being aware of us, they can help their students get access to us in a way that we may not otherwise reach them.
Exactly. So how can families assist their students in practicing proper coronavirus safety measures?
So probably first and foremost is be a role model for them. They're gonna emulate the things that you do. It's just like when, children are small and they copycat their parents. We still do that a bit as we get older, whether we like it or not. We do take on some characteristics of our parents as we get older. So, they're going to be looking to you and how you're responding to this and the actions that you're taking, and whether you're wearing a mask and using Germ-X and washing your hands, and are you socially distancing, or are you attending all of these large events in close quarters and things like that? So definitely, be a good role model. You following the safety precautions will encourage them to follow them as well. And vice versa, of course. If they're doing a really good job at it and you're slacking a little bit, those roles can be reversed. But it's a collective effort. Another thing is just making sure that they have the necessary supplies to protect themselves. Make sure they've got masks. If they don't have masks, help them get some masks. Make sure they have Germ-X with them wherever they go so that they can keep their hands clean if they don't have access to soap and water. Continue to communicate the importance of following safety protocols. So whether they be here at USM on our campus or within the local Hattiesburg community, or maybe it's something that's, coming from a top-down state health approach, being informed and making sure that they understand the importance of that as well. Because in a situation like this, it's not just about the individual, it's about our community as a whole, and, working together to keep each other well allows our students to be able to continue attending classes and have small programs with their peers where they're able to make social connections and have a semi or as normal a college experience right now as possible. So it takes all of us doing our part and working together. And so, just communicating that importance, encouraging them to do their part, and explaining to them, like it's for the greater good of everyone, so that you can have the best experience at Southern Miss that you have visualized as you prepare for college. So I think that's really the crux of how we can all work together on this, especially as parents and family units.
Absolutely. Kayla, our last question for today is, who should a parent or guardian contact if they have concerns about their student's health?
So, of course, I think it can be a little intimidating, especially when students go off and they leave their family, especially if it's the first child. It can be, a different experience, and it can be worrisome. I have a little boy and we're far from college, but I already think about like how I'm going to be on his first day of kindergarten and things like that. And so, thinking of it from a college perspective, you probably know your student better than anyone else. I mean, you've raised them for 18 plus years. And so, being able to pick up on, subtle changes, whether be it in their mood, their behavior, their academics, whatever it may be, if they're communicating with you or lack thereof, if they went from being super talkative and they'd call you, all the time to you're not really hearing from them as much, or if you're just noting some changes in, their overall health and well-being, definitely would, be better to reach out than to just let things ride and something unfortunate happen. And so there's a couple ways that you can kind of advocate for your student. We have what's called Campus Action Referral and Evaluation System, or CARE system for short. And this is made up of campus professionals from different areas of campus, and they work together to make sure that students who are identified through this system are connected with the resources that they need. So we actually encourage other students to use this as well, not just parents and families, because sometimes they can be worried about their peer, but worried about the repercussions of talking to someone about that peer. And so this is an option where students can actually report, a concern for their peer anonymously. And so this could also be a way that parents can reach out to get their student connected with resources on campus. Now, if it is something that's, emergent, or if you're concerned for their actual, well-being and their life in that moment, of course, we have campus police, University Police Department. You can certainly call them or call 911. But if it's something where you think they maybe just need to be connected with some resources, or maybe just talk to somebody else other than mom and dad, and get that input from someone else, the CARE system is a great way to do that. We also have the Dean of Students Office, which is part of the Division of Student Affairs, which is what our clinic falls under as well. We are all part of the Division of Student Affairs. You can actually reach out to them as well as another resource. As far as the clinic itself, we can't necessarily go to a person. That person has to make the decision to come and see us in order for us to be able to help them. And so the ball would be in their court at that point. But these other ways you can definitely utilize to get your student connected with who they would need to see.
Wonderful. Thank you very much for that. Kayla, it's been such a pleasure having you with us today and sharing information regarding student health services at Moffitt Health Center. Families, I hope that this has been beneficial to you and that you've received some information that you maybe didn't know or you've heard about but needed a little bit of a refresher. And hopefully this is content that you can share with your students as we enter into the spring semester. School starts next week officially for our full term classes. And so we're just really hopeful and grateful to be here for another semester in hopes that we will have a successful semester. Families, please know that Parent and Family Programs is always here for you. If you have questions about anything, you can reach out to us throughout the semester. We hope that you are members of our Parent and Family Association. Members of our association receive monthly e-newsletters, and in those newsletters are filled with pertinent information for your student as well as for yourself throughout the academic semester. Membership is free, and you can sign up for that today on our webpage. If you go to the USM website, type in the Center for Student Success, and once you're on that webpage, you can look for Parent and Family Programs, and underneath that, you'll see Parent and Family Association. You can also reach us via email at parentsandfamily@usm.edu. That's parents with an S and family at usm.edu. Or you can contact us via phone at 601-266-6405. If you have any questions as we prepare for the spring semester or after the semester starts, please feel free to reach out to us at any time, and we'll be glad to help you with anything that you need assistance with. Like I mentioned earlier in the video, this video will be saved on our Facebook page. So if you were unable to join us at noon and maybe missed a little bit at the beginning, please feel free to rewatch it until the end so that you can grasp all the information that Kayla provided, which has been thoroughly helpful. Kayla, thank you again for joining us. We look forward to working with you again in the future. And I will close out this video with a mantra that we all say here at Southern Miss, and it's Southern Miss to the top.
To the top.
Thank you, everyone, and have a great day.